Good morning, parents. Hearty welcome to the workshop hosted by Little Dentist, where we'll help parents in taking care of their children's dental hygiene. Today we have Dr. Manisha with us. She's a MDS periodontist who has been working with kids for past 10 plus years and is very passionate about the field. She's a professor in pediatric dentistry and has been teaching for more than 15 years. Good morning, doctor.
Good morning, Dhruv. How are you?
I'm good. I'm good, doctor. I'm good. So topic for today's workshop will be importance of brushing and how to encourage children
Very
to do.
important.
And we can,
Yes.
doctor, we can just start, on helping out parents to basically understand that when to start brushing in children and how to basically go about it.
Yes, parents come to me. The major problem they face is how to brush. My child is not brushing.
Right.
How do I, encourage the child to brush? So I think you have chosen a very good topic, Dhruv.
Yes, 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 doctor.
I'm sure we will be able to help parents. Yeah.
Yes, doctor. Yes, doctor. So basically, could you just, point out on how to basically, how the parents should basically start brushing in children and how,
Starting brushing should be right from birth. We always encourage the parents to brush right from birth, even if they are gum pads, before the eruption of milk tooth, by 6 months of age. Even before that, we have gum pads. The
okay,
health of gum pads are very, very important. So what the parents can do, they can maybe wrap a gauze or a single kerchief around finger, and they can clean the gum pads up and the lower gum pads, and also clean the tongue. So this can be a routine, maybe once in a day when they're giving bath to children. And when the brushing can be introduced in terms of finger brush, when the first tooth erupts, that is what is given by AAPD also, that we should introduce brushing in children the minute the first tooth erupts in the oral cavity, because with the eruption of tooth there is inhabitants of bacteria also.
got it, doctor.
Yeah.
Got it, doctor. So, and how should they go about it? Like, as children grow up, how to basically, inculcate this habit and how to basically go about this in children.
So basically, parents, what AAPD says is parents should be a very important part of brushing routine in children till 6 years of age.
Mm.
Rather, they encourage the parents to brush at least once in a day, and if possible, both morning and night. And supervise brushing up to even 10 years of age. Because we know children by their nature, that they wouldn't want to brush, or for some reason, maybe initially they want to hesitate because they don't want somebody to enter into the oral cavity, or maybe some sensory impairment in terms of the gums are teeth are erupting, the gums are little sore. So there could be any reason for which they would not want to perform oral hygiene, but we as parents, we need to hit on brushing. There is no way we cannot, or other one day also we can ignore brushing. Minimum 2 times in a day, morning, after breakfast or before breakfast, it doesn't matter, and night time before sleeping, it is mandatory to brush. Initially, up to maybe 1 year, you can just brush without a paste or a non-fluoride paste. And we get multiple brands like Chico, Pigeon, Mamaearth, which are non-fluoridated, because the children would not spit the toothpaste. They would rather swallow. Swallowing, why is it not healthy? Because the adult toothpaste contains fluoride, which is when it's ingested, it is not healthy. So there is a particular toothpaste which comes for babies below 3 years of age, which is non-fluoridated. So that is advocated for children until they learn to spit. Once they start spitting, they can shift from a non-fluoride to a baby paste. They cannot shift from non-fluoride paste to adult paste, because the amount of fluoride is very much high in adult toothpaste as compared to the baby's toothpaste. So we have multiple brands like Pediflor, Cheerio Gel, and all that, which your dentist or a pediatric dentist can recommend based upon the child's requirements in terms of cavities or regular routine checkups and all that, which the parents can uh, start using. But yeah, being a part of brushing is very, very important, or a oral hygiene routine. Gargling after every meal also is very much required, because that's what removes all the debris around the teeth after every meal. So children should be encouraged to brush twice daily and gargling after every meal. That's what I always insist my parents, and regular dental visits. Definitely, because what parents cannot see, the dentist can see. Sometimes the small things get unnoticed because children will not give you a history of pain, or they'll have some subjective fear of dentist, and they know that, okay, if I go to dentist, they will put injection, or maybe a fear of drill. So they wouldn't want to vocalize their dental pain. So in
Right.
that is why establishing a dental home parallel to medical home is very important, because that will help us recognize the condition at a very early stage before it comes to pain, swelling, or before it goes beyond hand. So when the child comes to us with the pain, already he has pain, then on top of that he has dental fear. So that's why the managing children becomes challenging. So what I request parents to establish a dental home routine also parallel to dental hygiene.
Got it, doctor. Doctor, also on the previous point, so why do you think, I mean, the behavior is there, so why are children generally reluctant towards brushing, and how to basically
See,
encourage
first
them?
and foremost, with their age, because of their age and the brushing obviously there will be little discomfort could be there, and it is just maybe below 3 years of children, below 3 years children are just by their behavior or by their age, they're not very mature to understand the importance, right? So it is until we insist. So what we insist becomes their behavior.
Hmm.
Then second of all, the teeth are erupting, the teeth are following, the shedding is happening. There is a sensory this thing impediment is there, wherein the gums are little sore, so or tender, or they are as I told you, maybe they are not telling us that there is an infection or pain, and that's why also they could be reluctant. So that's these three things we should keep in mind. Maybe just the age, and if it persists beyond age also, then we should understand that there is some, maybe infection or a pain which the child doesn't want to vocalize. So that is why it becomes more mandatory for you to rather start brushing, because if you don't brush, there will be plaque, there will be debris, and the infection and the inflammation will go on increasing. So it's like a vicious cycle. So then the dentist has to be called upon.
Got it, doctor. Also, are there like any specific, hacks or ways that parents can encourage their children to basically brush or,
Definitely,
Hmm.
definitely. We can make it like a group activity wherein all of us are brushing together, or make it like a game. Along with that, we can make a our family song for the brushing, or our family time during brushing.
Hmm.
So all that will encourage. Maybe when they don't know how to spit, they learn whom. The parents are the first teachers in the house. So when we teach them how to spit, so
Hmm.
that's when they encourage. So it can be like who spits the farthest, or
Hmm.
who is keeping the mouth doing more number of times this gargling activity. So
Hmm.
all those fun action, it depends upon parent to parent how they want to make it, but then yeah, it should be made a fun activity. It should not be like a routine. So when it comes to routine, children will become reluctant. So when it becomes a fun activity, they look forward to it. So
Hmm.
yeah, once they, and positive reinforcement is very important. So they, okay, we make a chart kind of a thing, and we tick mark, and once your tick mark is done for 15 days, we know that you're going to get an ice cream, or it's related to something positive. So
Hmm.
that's when children will definitely,
Right.
would want to follow the routine much in
Hmm.
a much organized manner also. And once it becomes organized manner, it becomes into a habit. Which even if we want, children will come and say, there are some of the parents who come and tell me that 21 days I did this chart activity, and now my child says, oh, I have to brush. My dentist has told me to brush. Because when they come back to me after first follow up, I give them maybe a certificate for a good oral hygiene, or as a reward, I give them maybe a brush or a new paste or something which gives them, or rather reinforces their behavior positively. So that really helps children.
Got it, doctor.
Yeah.
Thanks.
Encouragement and positive reinforcement, I would say.
That's great, doctor. Thanks a lot for all the information that you have given us today, and thanks for being part of the work.
Thank you so much for having me over, Dhruv. I hope I could answer your questions
Yes,
promptly.
yes, absolutely,
Yeah,
doctor.
I look forward to more such conversations. Yeah, have a good day, Dhruv.
You too,
Yeah.
doctor. Thank you.
Thank you, parents. Thank you.